So this is one where I feel very fortunate that I've observed and benefited from having a strong nursing partner in this space. Previously, I was at the AdventHealth Apopka campus for 5 years. And there, my partner, my CNO, her name is Melissa Leonard. We really recognize that there is a lot of work that we have done as a company in making sure that we are very strategic with the education and recommendations to nursing. And we're very strategic with the recommendations and teachings we have to physicians on patient experience. But the reality is if we continue to work in those silos in our own lanes, we're never going to get the outcome, right? Because what does the patient want at the end of the day? They want to see a nurse, a physician, and all of the rest of the team working cohesively to advance their care. And so it really goes down fundamentally to that nurse, that RN-MD relationship. And so one of the most important keys to success for patient experience has been understanding and removing barriers, whether they're real or perceived, that prevent effective and consistent RN-MD rounding at the bedside. Interestingly, we went on this journey over the last several months at the Apopka campus, and I'm really excited to dive in to see what opportunities we have at the Celebration campus, where when we actually got everybody in the room, all of the physicians, all of the hospital's physicians, a bunch of the nursing leaders from all the units, what we found was that every one of them said the same thing. We want to do RN-MD rounding. But what we discovered in this conversation with everybody in one room was the physicians were worried that the nurses were too busy and they didn't want to bother them. The nurses were worried that the physicians were too busy and they didn't want to bother them. And it was mind-blowing that it took all of us coming in a room together to say, wait a minute, you're all telling me you want to do the same thing, but you're nice people and you're afraid to put a burden on the other. And that quickly tore down this perceived barrier to RN-MD rounding. What came of that was, can you imagine what it'd be like as a patient to be in the room with your nurse who you see much more often than you see the physician, having a conversation, being able to ask questions, and to see that collegiality and that team approach to the care? That to me is just fundamentally the driving force behind improving the patient experience. Because in the end, it's what we would want for ourselves or for our family.